We're here today to talk about mental health in New York, and a new data brief published last week by the foundation showed that mental health rates in New York have stagnated after improving for a good period, after the record highs after the onset of the COVID-19 pandemic. We have a great turnout here today, which I think is reflective of how important this topic is. And how many New Yorkers' mental health impacts. As of March, 1 in 3 New Yorkers reported a mental health outcome of depression or anxiety. Today, we have two great discussants joining us. We have Kimberly A. Williams, CEO and President of Vibrant Emotional Health, a nonprofit organization that reaches over 3.6 million people each year to help achieve emotional well-being through high-quality, innovative programs. She began as a public policy intern in 2003, rising to president and CEO in 2017. She served the mental health industry through various positions, including mental health advocate, administrator, educator, and consultant. And as CEO, Williams has overseen the expansion of Vibrant's premier programs they administer, including the 988 Suicide Crisis Lifeline, Disaster Distress Helpline, and NYC Well, the city's cutting-edge multilingual, multimodal contact center and program that responds around the clock to the mental health needs of over 300,000 New Yorkers each year. We also have with us today Pamela Mattel, the CEO and President of Coordinated Behavioral Health Care, a substantial network of 78 nonprofit organizations transforming community care. Ms. Mattel is a highly qualified executive with 38 years of nonprofit experience. And Ms. Mattel is continually reimagining healthcare and social services by convening diverse groups of stakeholders and actively supporting collaboration. Ms. Mattel has worked across multiple nonprofits and community health centers, and this work has been augmented as an active participant on New York State's Medicaid redesign subcommittees, including health disparities and social determinants of health, numerous health-related board memberships, and local efforts. Before we dive into the conversations with these two discussants, I'm going to run through a very brief presentation reviewing a recent analysis we did at the Foundation on mental health data from the pandemic. Just as a quick reminder, please feel free to chat any questions throughout the presentation and discussion. I will be monitoring these questions and we will do our best to get to all of these questions, and we'll follow up after today's event with any of the questions that we do not get to. Right, to the first slide. So during the COVID-19 pandemic, next slide, please. There's been a significant focus on mental health. During the first year of the COVID pandemic alone, the World Health Organization estimated worldwide that there was a 25% increase of the mental health outcomes of anxiety and depression. Despite the public health emergency being declared over this past May, the effects of the pandemic, both physically and in terms of mental health, have been both widespread and enduring. Many of us understand that these effects are not truly over. Last week at the Foundation, we published a new data brief looking at census data from the Household Pulse Survey, looking at the outcomes of anxiety and/or depression among New Yorkers over the ages of 18, looking back from April 2020 through this March of 2023, almost 3 years of data. The results surprised us a bit to see that in terms of mental health outcomes for New Yorkers, they're really treading water. While some of the numbers have come down a bit since the highs in early 2021, much of the progress and improvements in mental health have stagnated. And in some cases, there were actually declines for some populations where mental health has worsened. More than 3 in 10 New Yorkers reported poor mental health outcomes, really showing no improvements from May of 2021, when 32% of New Yorkers reported poor mental health. Next slide, please. some groups of New Yorkers to highlight were disproportionately impacted by worse mental health outcomes. 1 in 2 New Yorkers with very low income have anxiety or depression. Younger New Yorkers are more likely to have anxiety or depression, as are Hispanic New Yorkers, as are New Yorkers who have lost employment income during the pandemic. And at a kind of most staggering rate, more than half of food insufficient New Yorkers are reporting poor mental health outcomes. Next slide, please. What we're really going to talk to, and is actually a nice segue into our conversation today, are some of the implications for policy and practice that we touched on a bit in our brief, but is a bit of a bright spot in terms of kind of mental health during the pandemic. While these data aren't particularly promising, a bright spot is the fact that during the pandemic, some of the conversations around mental health brought mental health out of the background and into the foreground. And bringing it out into the foreground really helped result in some meaningful policy conversations and into some investment and traction. In New York State, both at the state and local levels, there are some new plans on the table that will inject significant dollars and new programs into place that will address some long-needed mental health resources into the community. We have likely all heard of the governor's billion-dollar investment. She was just a few days ago had an op-ed in the Daily News about her commitment to using these $1 billion, hoping to be a national model for children's mental health needs. So this seems to be something that's really still top of mind for the governor. And both at the city level, the mayor's office and the city council have mental health plans, which are really a promising start to building a stronger mental health system at the city and state level. And of course, the success of these plans really rely on the wonderful work and the commitment and foundation that has already been built by community partners, like the two that we have speaking with us today here. So I think that that is a great segue into the conversation that we have with Kim Williams and Pamela Mattel. So I think without further ado, we will get into the discussion portion of today's event. So I'd really like to start off the conversation today with you, Kim, speaking about the changing state of mental health, sort of in terms of policy and practice, sort of before, during, after the pandemic. And maybe you could talk a little bit about some of the federal, maybe a bit of state and local, but maybe starting at the federal level of how this has changed.
Thanks, Mary. And it's a pleasure to be here this afternoon. You know, first, I think it's important in looking at this data that we think about the COVID-19 pandemic in the context of disasters, because the pandemic was a global public health disaster. And we know from natural disasters like hurricanes and wildfires and human-caused disasters like mass shootings or war that they take a tremendous toll on mental health. And that it's common for people to experience, you know, fear, anxiety, distress before, during, and after an abnormal event like a disaster. So it's not surprising that the pandemic has had such a significant impact on the mental health of New Yorkers. But nothing has been as pervasive and as prolonged as the COVID-19 pandemic has happened, you know, in the U.S. in recent history. So when we look at, you know, typical acute stress responses that would normally resolve over a reasonable period of time, right, like 30 to 90 days, stress, anxiety, grief, they remain constant. And, you know, the data from other disasters tells us that the demand for mental health support, which, as we know, increased dramatically during the worst of the pandemic, that it's going to continue for months, if not years. Just by way of example, after Hurricane Katrina, rates of post-traumatic stress disorder in people whose homes were destroyed or damaged remained high, even, 5 years later. So, we have some people who can become depressed or develop panic attacks or have exacerbations of existing conditions during the acute phase of a disaster. And some people who can experience mental health issues in the immediate aftermath when things start to, normalize. And some people might feel the effects even later. And obviously, one of the most widespread mental health issues that has arisen is really coping with the anguish of loss, right? Whether that was loss of family, friends, loss of income, food, housing security, as is noted in this data. So now having said all of that, recovery is still the norm. Majority of people will be resilient and go back to the way that it was before, but many people are going to be changed in some way. And so it's expected that there is going to be an increase in mental health need for some time to come. And we know also that mental health challenges were already climbing before COVID. And really it was the pandemic, the unfathomable number of deaths, a pervasive sense of fear, economic instability, forced physical distancing, that really exacerbated unprecedented stresses. And so with that recognition, during the pandemic, one of the most significant changes in mental health policy were shifts in policy and regulation to increase access to specifically telemental health support in response to the increased demand, the increased need, and also in recognition of mandated social distancing, that people couldn't go to their typical services and programs. And so at the federal level, we saw increased funding for new telemental health initiatives. Medicare waived telemental health co-payments, reimbursed audio-only visits, as well as required payment parities between virtual and in-person visits. And then you had many states across the country, including New York, that allowed for telemental health coverage. And some of these telemental health flexibilities have been made permanent, have continued. And so this has really allowed for people to get access to the care that they need. And then as a result of just this continued recognized high level of mental health need, we've also seen mental health being prioritized really at all levels of government, as was noted, with unprecedented shifts like we've never seen in mental health public policy and investments to really build a better resourced, more comprehensive mental health system. And I'm happy to touch on more of that as we continue this discussion.
Great. And same question to you, Pam. Where do you see changes in the state of mental health during the pandemic, either from a policy or practice perspective?
Sorry, really building on the great opening that Kim shared, I think one point that I'd really like to emphasize is that in the face of a disaster, we were able to really shift our mental models and think outside of the norm and bring together ideas really for the best interest of public health. And so it was the first time for us collectively as a state, and I think as a country, to see major systems dropping their turf and coming together to really open supply chains, talent management, like all those things that were so critical. We saw it many years ago, I think, Kim, as you had mentioned during the Katrina, et cetera. But this, because I think of its national impact, really inspired people to be a lot more collaborative. And what was refreshing is the speed in which government was able to relax regulation and in the best interest of the population. And that was really, I have to say, inspiring, because many of us who work with great persistence at administrative reform, saw that when there's will at the table, things can move at the speed of light. And I think that is a really good lesson for us going forward.
Wonderful. So my next question starts with you, Pam. Could you talk a little bit about the role of partnerships and collaboration and how they can include social determinants in shaping successful mental health work?
Well, that makes sense, given that I was just talking about the speed of change and collaboration. I have really been thinking and working sort of in this space for a really long time, and really appreciate you giving space to talking about re-envisioning collaboration in our current environment. So a couple of key points I have. The first is I really believe that our field has been steadily moving in the direction of collaboration, although our efforts have, I think, at times been best incremental and mostly transactional. And I think the problem with the transactional approaches to partnering is that more often than we would like to admit, they can devolve into turf issues, and that the dynamics can shift the calculations where one or more of the collaborators starts to get maximum value, and it is not equally shared amongst all of the partners. The other thing that I think is important as we sort of think through re-envisioning collaboration is that many of our current partnerships are really workarounds to our fragmented system. And when they're workarounds, while we're trying to improve, in some ways, we're actually reinforcing the system. Our policies, regulations, and funding do present a lot of challenges to shifting away from this transactional collaboration, and really have great admiration for the governor and the mayor around the investment that's being made. It really is unparalleled, and it values mental health as health. But I also suggest, just as being a little provocative, that adding more programs is necessary, but it's insufficient. And that what still remains is significant gatekeeping policies that have restricted access and continue with the system fragmentation. I'm under no illusion that those are easy to solve problems, but I think we need to keep them in the foreground. The other thing that makes me think about this amazing investment is, one, how many of these newly funded programs are again workarounds to outdated policies. For example, the care management movement was really developed to deal with our system fragmentation and health inequities. And we have now created care managers in almost every program. And that in itself has resulted, I think, an unintended consequence of expensive duplication, accountability issues, diffuse outcome measures, and I think at the heart of this, a poor experience for our clients. While I also really am encouraged that the narrative is improving, I think it's important while we're thinking about this is that the models driving the financing of whole person care also needs to catch up with the narrative. And then our data and technology is still elusive for the mental health, behavioral health, and sort of housing, social care field. And the reluctance to speed opening more avenues to data transparency is going to be hindering our deeper collaboration. I do have a lot to say about the challenges to collaboration, and I promise to get to what I think is a really good opportunity for us. The other thing that is important is that the power balance has not yet noticeably shifted from the more prominent role of hospitals and managed care. It's not to call out that those aren't systems that are highly valued, but when we're thinking about collaboration and partnership, we also need to be moving in the direction of more equal status at the table. And I would say that where we're going in collaboration and partnerships needs to really include the diverse community resources, including the clients on our side of the table. We've developed collectively MOUs, referrals, handoffs, workflows, and I think we know that there's a lot more to do. When I watch what retail innovators are doing, they're advancing collaborative models and they're aggressively incorporating data to customize messaging and products. And when we're thinking about how to reach our needed population, we're relying on sort of the traditional assessments, which can be repetitive and again, may be resulting in poor patient experience. I do think that there are outstanding examples of innovative collaboration and partnership. And I know that Kim has a couple of good ones. I'll say just briefly before I talk about radical collaboration, that the governor's project, the Safe Option Support Program, which is for people who are homeless living on the street or transit sites, has really evolved into a collective impact project that has brought multiple providers together, including non-traditional providers like the MTA, DHS, NYPD, et cetera. And I think that the recognition that this complex social problem needs to bring as many under the tent as possible is really pushing the envelope in the right direction. And I will share, as leading the SOS program from CBC, the data sharing agreements in itself are pushing the boundaries of defining roles and responsibilities and asking a lot of us to move out of our comfort zones, which is exactly what we need. I would say to achieve some of the collaboration that I'm hinting about is to move beyond the quid pro quo approach and mobilize and maintain over time everyone's contribution of time, energy, resource, and knowledge. And I think what I'd like to really share is I came across this phrase, radical collaboration, a few weeks ago. Lo and behold, it's not a new phrase. It's been in the human design thinking discipline as well as other places. There's a ton of information on it. And it was really appealing to me, and I was trying to think more about how do we get to the next step. And so radical collaboration really values that the process is the solution, and that it means being willing to engage in shared decision making. And in some cases, really foregoing the power and privilege for individual organizations in exchange for arrangements that benefit the whole. And, in doing so, we have to come from a sense of abundance and the spirit of our shared humanity, which was so apparent a couple of years ago at the beginning of and throughout the pandemic crisis. I think moving the needle on the mental health crisis complex problem is not a neat, tidy, straight line. And so I would suggest that radical collaboration might see behavioral health, public health, primary health care, and social care as equal partners. And that these type of radically collaborative teams don't just create products for users, but with the users. And by getting out into the world to understand the lives and lived experience of the users, and by engaging them directly, I think we also really open the door for people with lived experience to be on our side of the table.
Thank you, Pam. That's great. And then Kim, similarly, could you talk a little bit about partnerships, maybe if you have an example or two of how they can help shape successful work and maybe their inclusion with social determinants?
Yeah, I really appreciated Pam's comments around how to address the complexity of mental health need, and that it really requires various systems to come together. And I think there's been recognition that in order to effectively support people and communities, providers and systems need to figure out how to collaborate to ensure people are truly getting access to the right care at the right time and the right amount, and that we're supporting people along in their journey and they don't fall through the cracks. As Pam noted, it's the implementation of it that is the real challenge. I will say that, one example really at scale where there is an effort to work together is around the planning, implementation, and the continued building of the 988 Suicide and Crisis Lifeline, which is really a significant transformation for accessing mental health. The Lifeline it's funded by the Substance Abuse and Mental Health Services Administration and administered by Vibrant. The Lifeline launched initially back in 2005 as a 1-800 number, and in July of last year transitioned to a 3-digit number, 988, to make it far easier for people to access support in times of emotional distress. And it is free, it's confidential, and it's for anyone who is looking for support, is in a suicidal crisis or is experiencing distress, and they can reach out around the clock via call, text, or chat. And what's important is that the Lifeline is made up of a network of over 200 independently operated local crisis centers across the country. So it's ministered nationally, but it's really implemented locally. And so in order to ensure an effective transition, so many stakeholders at the federal, state, and local governments, providers, advocates, policymakers, researchers, persons with lived experience have really needed to come together in support of prioritizing this and also ensuring that it's adequately funded at a national and at a local level. And not only for the line itself, but really the broader mental health continuum that the service represents, right? Because it's about getting access to resources in local communities. And so the federal government has invested nearly $1 billion in funding, an unprecedented amount to support the Lifeline, and including an initial investment of $432 million around the transition last year. And then again, we have additional investments that have been made in various states and localities. It's also worth noting that prior to the rollout of 988, Vibrant provided grants to states to help them prepare for the implementation. So 49 states and US territories received grant awards. And really the goal was to help states plan for what was going to be needed for projecting infrastructure needs, volume growth, and how to ensure access to the new 988 number. And as part of that effort and kind of developing these roadmaps for planning and for coordination, it was required that there would be multi-stakeholder input through a 988 coalition. And so ensuring that as part of the planning process, that there was wide representation from individuals with lived experience, from crisis centers, from state suicide prevention coordinators, from mobile crisis teams, crisis respite, from law enforcement, from 911, from peers, as well as just other stakeholders, providers in the mental health and suicide prevention community, to come together to be a part of the planning process. And that work continues. Again, this is multi level and very much across the community, and to ensure continued effective implementation, because we're only 1 year out, it's going to require continued engagement and collaboration. And the other thing I would just note, because we're talking, you weaved in social determinants here, is that, we know that the pandemic has really exacerbated long-standing disparities in our society, and that supporting mental health isn't just about getting access to care and treatment. It really requires that we address all of the social determinants of mental health, including income, housing, education, access to healthcare, right? These are the foundational aspects of life that directly contribute to well-being. And so by investing in reducing poverty, ensuring access to quality education, healthy food, affordable housing, employment opportunities, safe neighborhoods. So by addressing those things that we address the economic and social barriers that contribute to poor mental health. And so these also, have to be prioritized. And, overall, we have to prioritize building a system that is really, truly responsive to this broader array of needs, within that individuals and communities are facing.
Wonderful. And I think this might be a great segue to the next question. But as we're having all of these conversations, how do we ensure that consumers are part of this conversation? And Pam, I would ask you to maybe take on this question first.
Yeah, thank you. I think for a long time, if I even go back just to think on the alcohol and substance use side, that self-help groups recognized the power and value of talking with other people who have had that lived experience. I think where we're beginning to catch up is that those are not separate groups of which we send people to, and then we do our professional piece, and then you sort of go back and forth. And that building the system that Kimberly is really talking about requires, I think, really requires that it's one integrated system where each voice is really valued. So I know that in many of our organizations, we have consumer advisory boards, we have peers on teams, etc. And one example that I will tell you is agency was talking to me about their consumer advisory board, and I asked how that group participates, and they say, well, we figure out what's important, and we bring them policy, procedure, whatever it is, and we ask for their feedback, and then we make changes. And so that helped us get into a conversation of what we decide is priority is filtered and may not be what matters most to the people who we're serving. And so what I find myself continually reminding myself and others is there has to be a seat at the table where we are exploring the problem, generating solutions, and then plans. It after the fact isn't as elegant. And retailers like Amazon and all the places that we well know, they already know this, and they are pulling data, information, focus groups, people at the table in a first-person way to really figure out what is needed. So my pitch here really is for people that we're serving to be equal on our side of the table. They're not being served, but they're part of the solution.
And same question to you, Kim. How do we ensure that consumers are part of this conversation?
Yeah, I'm going to reinforce a lot of what Pam said. Consumers have to be at the center of everything that we do. Who are we building services for, if not for the people whose lives are going to be impacted by them? So, I think this is particularly important when we talk about continuing to expand and build support for historically harmed and excluded communities, LGBTQ+ youth and young adults, persons from tribal nations, Black and Brown communities, as well as, persons with functional disabilities. We have to ensure that we are directly engaging with them in designing care for themselves, right? Communities they're the experts on their own experience and the experience of people who've not been well served. And so they have to be a part of ensuring that the system of care that's being built is really going to meet their needs. And so I'd say, when we are building coalitions or advisory councils, right, ensuring, as Pam noted, that the consumers are at the table where decisions are being made, that they have a voice in what services are going to look like for them. And, just by way of example, in some of the work that we are doing, in partnership with many key stakeholders around the country in building out 988, we worked in partnership with SAMHSA and building out a LGBTQ plus line for young people. And as part of that, build an advisory group of individuals, with various expertise to ensure that we were getting input on how this service is going to be designed going forward to ensure that is truly meeting the needs of the community. I also think sometimes it takes longer to do these things, right? In building coalitions or advisory councils, but it is really critical to ensure that we're building a system that is truly going to meet people's needs.
Mary, may I build on something that Kimberly
Yeah,
was?
absolutely. Please do.
And also a little bit back to some of the other things that you were saying. It made me think about two things. One is, and I saw the question in the chat about how do we help people who are waiting for an appointment. And this sort of brings to mind for me, how are we determining who are helpers, who are the experts, what is really the resource? And so an example that I can give before the pandemic is there was a program that used the mailman to check in on people who were senior citizens not leaving their home, or people who had other mental health issues, just a knock on the door. How are you doing? And when I think about the loneliness that we've experienced during the pandemic, the mailman always came to the house, but I don't know that we thought that that would be a good person, a good resource for us to be leveraging. So sometimes the way that we think about our system could be a lot more inclusive. And one of the lessons I think that we got, and I'm so glad that you phrased the pandemic as a disaster, Kimberly, is that helped us think beyond our four walls. And there's so much out there. You're right, people with the issues are the experts in their experience, but they're also experts in all those things sort of in the shadows that we don't know about, that we should be inviting. And one other piece here that I would say is we're talking about the workforce crisis, which is huge in our field. And again, who are we inviting under the tent to be part of the workforce? I think if, again, we come back to a spirit of abundance, there is a lot at the table as long as we are open to radically collaborating with as open as possible.
Wonderful. Thank you for adding that on and taking one of the audience questions. So my next question is really about capitalizing on this momentum, realizing that this is really a unique moment, I say sort of an unprecedented. I think we're all kind of sick maybe of hearing the term unprecedented. It's been unprecedented how many times we've heard the word unprecedented. How do we really capitalize on this momentum? How do we ensure that this doesn't kind of slip away without us really harnessing it and ensuring that it's sustained in the future? And so maybe Kim, you can kind of kick us off with that question.
Glad to. I think the fact that the pandemic was this global phenomenon, right, means that mental health symptoms were experienced to a greater or lesser degree by almost everyone, right? So there's this shared experience there, and as a result, there's shared sort of decrease in shame around asking for help. And it also has obviously elevated this level of importance of mental health in our society. And so we're seeing this much more level of focus at all levels of government investing in mental health, which is, as noted, is really terrific because historically there really has been limited investment. Mental health has been so under-resourced. And in particular, there's certain areas of the mental health sector where the policy forces are kind of aligning at a federal, state, and local level and really driving positive change. But I think, to the point of this question, right, in order to kind of get this opportunity right, it requires commitment from all stakeholders, from government, from providers, from the private sector. That's got to be sustained over time. And so with this sort of widespread recognition of the importance of mental health to overall functioning and well-being, there's just really an important opportunity to ensure that mental health continues to remain at the forefront of policy and funding priorities, and to kind of fulfill the promise of the investments that have been made. It's going to require continued partnership and action to ensure that there is sustained investment in really creating a collaborative mental health system in really every community across the country, obviously including New York. So kind of now is the time to keep the momentum and the intention on mental health and the need, and also to demonstrate impact. I think it's helpful to show where investments have been made, the impact that's had on people being able to get access to getting better care, better outcomes, decreasing, more costly services, and overall just helping people thrive in their communities.
Pam, what are your thoughts on this? How do we keep this momentum?
Yeah, I'm scribbling many notes as I'm listening to Kimberly. So thank you for your comments. The first is, it also reminds me about how we start going from crawling to walking, and that there's an enormous amount of persistence and drive to, I have to do this despite the fact that I can't do it yet. And reliance on others in our environment to help. Remember, my youngest held onto my pinky no matter where we went, just so that he could learn to walk better and faster. So I think one is to come at this with the absolute enthusiasm to learn. And not to think that we know, because I don't think that we do in this current new opportunity. The other, I'm sort of going through the life cycle, is the drive to learn as kids, and then as adolescents, even as toddlers, to question everything. And I mean that with the utmost respect. It's when we fall into the status quo, oh, that's the way government works, oh, those are the policy and procedures, we totally miss the opportunity for innovation. And so I think to keep the momentum, we really, I would be asking us to be very disciplined in questioning everything with an open mind, and be less defensive and more open and vulnerable. And then three other things I would say, traditionally, when we're trying to solve a problem as human beings, we come at it at a very sort of quick, I think this is the idea, we're problem solvers. And if we could invest a little bit more in root cause analysis and really understand why the problem is there, we really even understand what the problem is that we're trying to solve, would be important. Two other things, if we can, to maintain the momentum, we have to see our programs as part of the ecosystem. Can't just keep putting up programs and hope that they're going to make the connections. That they really have to be placed with meaningful participation. And in the end, just probably where I should have started, taking care of ourselves is so important. I read a note from another health system on the West Coast, and they're talking to all of their thousands of employees, and their pitch is give goosebumps, spark joy, take care of yourself, and make the community better.
That's wonderful. Thank you both so much for all of these comments. We've got a couple audience questions. One, I think we touched on a little bit, but it's about stigma. It's one that I've thought of quite a lot, actually, kind of through the pandemic. And I think I've got some thoughts on it, but I've certainly had my own questions around this. So I don't know if either of you might want to kind of volunteer to take this, or I can pick on one of you. But whether or not you feel like there's been improvements sort of in the stigma around mental health in the pandemic, whether or not that might be sort of related to why there has been an uptick in folks reporting mental health outcomes, and whether or not maybe either of y'all are aware of any data on the stigma kind of question. Pam, you're not on mute, so I might pick on you, but Kim, I also saw you just take yourself off mute, so.
I'm going to say one thing, and I know, Kimberly, you have a lot to offer on this. In answer to what you were saying about the reduction or shift in stigma, it really depends on who you're talking to, which culture, which community, which age group, etc. I'm happy that the narrative is more generalized and that we can talk about it, and there's more on TV, etc., social media, but I don't think that it's hit a place where any of us feel comfortable yet.
I think that was well said, Pam. It really does depend on who we're talking about. You know, for instance, when we're talking about young people, there's much less stigma among younger people in talking about mental health distress, but you know, it hasn't necessarily lifted for certain communities, and so we still have a ways to go here. And I think that's why when we're talking about investments in mental health, shifts in the system, the part of what we need to be building is greater public awareness around mental health support, and ensuring that we are doing that in a way that communicates messages that are going to essentially invite people to reach out for support in ways that they are most comfortable. And this goes back to why we need to be engaging directly with individuals with lived experience to really understand from their perspective what kind of messaging would be most meaningful to them, what kind of supports would be most meaningful to them. Sometimes it's not treatment. Sometimes it's about re-engaging with their natural helpers in their communities, right? And that also might require training those community helpers to better identify mental health issues and be able to effectively engage with their community members. So this is the time is now, the opportunity is now to really be rethinking how we can build mental health support beyond just the traditional system that we think about in a more community-wide way.
So another question that we got from the audience is actually something we didn't touch on actually at all today, and I feel somewhat remiss in not bringing this up at all, but actually is speaking about mental health workers in the workforce at all. And the question was a bit about cultivating more mental health workers. So I'm wondering if maybe either of you could just speak a little bit about kind of the role of the mental health workforce, if there are any maybe opportunities that you all see sort of in the next phase of kind of this mental health work to build out the mental health workforce and kind of the needs that kind of must be present to kind of adequately support the mental health workforce. Because I think really in the pandemic, there were some both shortages, and then of course the mental health and just I think the healthcare workforce in general was really strained during the pandemic. So I don't know if you both have some thoughts to share there.
Oh, Kim, you want to start, or?
Sure, I'm happy to. Yeah. You know, the workforce challenges are significant. and they're not new. It's something that's been going on for a long time. Demographics are against us, right? For many reasons. And so, yes, we do need to ensure that we're continuing to build the workforce. We need to ensure that we are building this as a career for people, and of course, investing in the current workforce. But we also have to, I think, again, think creatively about the workforce in general, looking for opportunities to how we can build out pathways for people that enter the mental health workforce, right? So it's not just one particular role, but looking for ways to ensure that people can be sustained in the workforce and grow within the broader mental health system. And what I mean by that is, right, growing, for example, from being like a mental health crisis counselor to perhaps engaging on a mobile crisis team. It again requires collaboration. I also think there are opportunities in thinking about, AmeriCorps, right, for mental health, right? That there's this like national workforce crisis that we're experiencing in mental health. How can we engage nationally to create an opportunity for people to actually invest some of their time into supporting, the mental health of the nation?
Yeah, I would add a few things to that. I know that in my organization, I have us rethinking educational requirements and qualifications. Because that's not getting the people that we anticipate to recruit. So, we say if you keep doing something with the same results, expecting something different, that's a little bit of insanity. So we're doing that. We're expecting that if we do the same thing, that we will get a different result. And so I'm asking ourselves to rethink who, what, where do we need people? So one is I would challenge that. The other is, and I think it's been a theme of a lot of the stuff that we've been saying, is the value of diverse perspectives to help create more health and wellness. And so the more diverse perspective we have, I think the stronger our system will be. And then, of course, and Kimberly, I was right along with you. I was on like the workforce crisis task force in like 2000, and we published major reports. So this was a crisis that has been a long time coming. And I think that we're making some progress with increasing compensation, but that also has to go with increasing the perception and the value of the job. And so we're talking about stigma for people receiving care. We're also talking about stigma of working in the field. So it's one big loop. It feels similarly about the way people talk about teachers. Like some of us who are really in the human service field, our work needs to be valued differently in the country.
Great. And I have one last question for you both, since we're getting a little close on time here, but it's really about data, and actually maybe a little bit kind of bringing us back to some of the data at the beginning of the presentation, and kind of about how do we know whether we're really making progress on some of these mental health outcomes? Are some of these more global health outcome measures really what we should be looking to as the Northern Star and how we're making progress? Or is there a kind of better way to be thinking about progress and impact?
You're asking that question with 4 minutes left. It's an amazing question.
Yes, and maybe.
It's an amazing question. You made me think about when data was published about maternal mortality for women who are African American and Black, that changed the way that we were thinking about maternal outcomes. Our data needs to be firmly rooted in health equity, disparities, racial bias, et cetera. until we really understand it from that perspective, I'm not sure that we can call it a day.
Yeah, I would just add, I think we have to continue to collect data to understand impact. It reveals for us, where there are disparities in care and therefore where we need to be making investments. And so I think data and research, again, as we're talking about where investments are being made, that this is an area of tremendous need, continued need.
All right, fantastic. Well, do either of you have kind of a final takeaway for today?
I think, I have held on to the phrase, it's not mine, just inspired by it, be the change you wish to see in the world. And I think this is a perfect moment in history where, and I think Kimberly, you had really said this, is really the call to action, that if you really believe in that, it's a daily mission. And I hope, I certainly am walking away, and I really appreciate the conversation, Mary and Kimberly. I'm walking away with a renewed commitment that I can do even more.
Thank you, Pam.
Yes, thank you, Pam. I would just say for those, who are joining or listening later to listen to that call for action, right? That no matter where you sit, would ask that you continue your support and ensure that mental health continues to be prioritized and invested in. And thanks for the opportunity.
Wonderful. Wonderful. Thank you both so much for this very thoughtful and inspiring conversation.